So, Dr. Naidu, this is very exciting, very thrilling. And as we were just talking about, there have been so many community questions. We love our brains. And and I think it's also really nice to be having this conversation, and predominantly the questions that came in were from females, save for two questions that we're going to get to. And you are a female, and an MD and a psychiatrist and on the faculty of Harvard Medical School. And I'm asking you these questions about the brain. And rarely do we get to have a really female-driven deep dive into the brain. And I think that's interesting. And I think it comes from just historically the way women have been marketed to. And there's this thought and theory that women really care about their skin, hair, and nails, and brain is traditionally for men. So there's many things I'm excited about in this conversation, but that's one of them, is a really female-centered deep dive into the brain.
So I love that, Amanda, and I thank you for this invitation. I'm excited to speak to you and your community. What you're saying makes so much of sense to me because even medical research has largely been done on men. And so in more ways than one, women have been excluded from this picture. One of the big areas is also kind of hormonal states, and as women age, something I come across a lot is, being treated a little differently by their clinicians and being told that symptoms of menopause are just in their head, for example. And a little disappointing sometimes, being given a medication without really hearing what their body is going through and what they might need as a real solution.
Yeah. Well, we are gonna predominantly do community questions today because there were so many. But I want to just get you to ground us in this conversation on two terms that I think will really help us along. One is, can you tell us what neuroinflammation is?
I can. Neuroinflammation essentially is brain inflammation. But the newer emerging science around the gut-brain connection and the gut-brain ecosystem that really has come forward in the last decade and a half to 2 decades is what has helped us understand this a little bit better. If I were to dive deeper into that, Hippocrates, the father of modern allopathic medicine, referred to the gut-brain connection in his own words eons ago, but science had to catch up. And now that we understand the gut and brain are connected, and that they arise from the exact same cells in the human embryo, the neural crest cells, they then divide up, grow apart, and form these two organs, but remain connected throughout life by the 10th cranial nerve, which is our vagus nerve. The vagus nerve acts like a two-way text messaging system, allowing for these chemical messages to go back and forth all day, all night. One of the things that happens, and one of the mechanisms, is that as we eat food and digest food, that food, be it a healthy meal or not healthy meal, interacts with the gut microbes. There are trillions of microbes in the gut microbiome, and we use the term microbiome when we refer to the microbes along with their genetic material. These microbes consume the food like we consume the food, and they interact with the food. And I like to explain it the same, Amanda. On days that we're eating those healthier meals, the breakdown products are healthy for our gut, like short-chain fatty acids. An example is butyrate. They are supporting that gut environment and doing good things for us. In fact, they're working against inflammation. They're anti-inflammatory. But on days that we may be going to, the fast food places every single meal, those foods are generally pro-inflammatory, and they feed the negative or not so healthy microbes in our gut. So those bad guy microbes actually consume these products, and their breakdown products are toxic to the gut and cause inflammation. they also start to damage the single cell lining of the gut, which is very delicate. As it starts to damage that gut lining, you get things like leaky gut develop over time. But given that the gut and brain are connected, if you have that intestinal permeability or leaky gut, that's going to feed back in a loop to the brain.
Mhm.
Ultimately, this over time leads to inflammation in the brain or neuroinflammation. So it's one way to explain that food is very powerful in this connection, and how we eat over time can positively or negatively impact neuroinflammation.
Yeah. And we could spend 2 weeks talking about all the dietary things that would be helpful and not helpful. But, and I'm sure we will get more into it later, but if we could just at this moment, what are the top 3 inflammatory things for your gut that will eventually turn into neuroinflammation? If you could get somebody to just avoid 3
Yes.
things for the most part.
Mhm. Sugar, so added sugars and processed sugars, sugar in all forms, not necessarily from fruit, because I want people to be eating a couple of servings of fruit a day. And we can go deep into that in a second, but sugar from processed sources is not good for our brain. So added sugars. The second is pro-inflammatory oils, often used, say, in fast food restaurants because they're cost effective or cheaper. And those upset the omega-3, omega-6 ratio in the body and brain and tend to be pro-inflammatory. And the third one is actually, it's, I'm trying, you asked me for 3 and I kind of have 4. But the third one, I would say, I would say artificial sweeteners, Amanda, because most people want to say come off a sugary soda, but artificial sweeteners disrupt the gut microbiome. And the fourth is the processed, ultra processed foods that we can't avoid them, but we can make best choices when we eat them.
Okay. I have some clarifying questions. So
Yeah,
number
of
1,
course.
added sugars. This includes honey, maple syrup.
So by added sugars, most, you know how the packaging in on foods now lists added sugars because that was a new rule that came out a couple of years ago. I'm worried about those added sugars. A touch of honey, I think, is fine. In fact, I use those and I use that in my recipe because honey has other benefits if
Yeah.
you consume honey. I think that with all the other sugars, the agave, molasses, maple syrup, all of those, if you're using a little bit once in a while, that's fine. But if that's something you're eating every day, I would rather use a touch of honey in your whatever your breakfast is, than the others, because ultimately they all break down to sugar, if that makes sense.
Yep.
So the value of honey is that it has other health benefits for you.
Qualities.
A little bit, yeah, a little bit, you know, in moderation. Yeah. But I'm
Want,
much more worried about the high fructose corn syrup that people do not realize are in many even savory foods, and until they look at the label.
yeah. And oils.
Mhm.
We've got a lot of questions about seed oils.
Hmm.
This community is pretty hip to seed oils. So would you say that those oils that you're talking about, that's the seed oils like canola, I feel like sunflower seed oil.
Yeah, yeah, yeah. There are lots of, one of the things I want to preface, I want to say 2 things, if I might, Amanda. Just going back to sugar for a second, there's a really, and if your community loves the science part of it, there's a repository of names of other names for sugar on food labels, which is worth them knowing. And there are 262, the last count, other names for sugar on food labels. Those are the sugars I'm concerned about because it's they in these processed foods and we don't even recognize that they're sugar. So just that's one thing, and I'm happy to send your team a link to that. And the second question is in nutrition science, there are evolving research studies going on all the time. So I want to be careful about how I answer this question, because if you do consume sunflower seed oil, you know, the sunflower seeds are different from the processed oil, right? That's the one thing. Because we often get a lot of people very upset about some of this information. I'm referring to the seed oils because they do change that ratio towards inflammation, which we just spoke about. I like people to be guided towards things like avocado oil, extra virgin olive oil, a little bit of coconut oil. Traditionally, South Asian cuisine is cooked with ghee, a little bit of clarified butter. Once in a while, completely fine. But a reliance on, say, canola oils and others and those processed vegetable oils, often marketed as vegetable, but actually are made largely of soy. That's a very different product from edamame or organic non-GMO tofu. Very different when it's processed into the oil. So that's the kind of clarification I want to make for people.
Okay. And then my last question is, I noticed that alcohol was not in the top 4.
Yeah. So I think I think it could be. I think it could be. It's definitely in the top 5. I feel that with alcohol, there right now is a kind of a direction that the use of alcohol movement is going in, and some of it is very split between never drink a glass of wine or consume any alcohol at all, and another group is let's use these guidelines, and I think I'm somewhere in between. In specific cases, my nutritional psychiatry plans are highly personalized now over the evolution of my clinic. And some people cannot tolerate any alcohol at all. Some people simply don't want it because of other views. And some people struggle with it. And COVID has been a tough time for people because of the work from home situation, lack of social connection. I had a lot of situations where people were consuming much more alcohol than usual. So there was a way in which we had to work on cutting that back. Where I am with it is, if you drink alcohol, have clean versions, the cleanest that you can. And I can explain that, and only in moderation. And if alcohol is not for you, by all means, that's completely respectable. Does alcohol affect the brain? Yes, it does. In moderation, there have been mixed studies on that. So I think that it's a personal choice. A clean cocktail is very different from a sugar-laden cocktail. So if you are having a cocktail and it has fruit juice and simple syrup and tons of stuff in it and 3 types of liqueurs, it's not just the calories, it's the amount of sugar on your brain and your body. That's very different from a plain liqueur with a squeeze of lime in it or something like that. And there are also wines now that are being marketed with no sugar added, and some newer varieties, which I think are actually some good options for people. And also, I love the fact that there's a whole new movement around replacements for alcohol and botanicals, which I love. So I think there are options for everyone.
Okay, great. Okay, so that was an amazing grounding into neuroinflammation. Thank you. I think that information just about the gut brain connection, I've actually never heard anyone describe it that way. So that was really valuable. Thank you. Neurotransmitters, can you tell us what they are? And I think we all know them with their individual names, but just as a category, and then maybe you can give us some of those names.
Right. So I'd like to use the example of serotonin because people call it the happiness hormone. It's a neurotransmitter upon which several even psychiatric medications are structured. Interesting thing about serotonin is there was a very good research study from a group in the UK published during last year, which kind of questioned the serotonin hypothesis in depression. And I think that while it should not cause people to come off their medication or be concerned, I do think this again speaks to the evolving nature of the science. And it should make us realize that it's not just one mechanism. All to say, serotonin is definitely impacted and affected in mental health. It's one of the neurotransmitters. It is basically a signal between, let's take the gut-brain axis since we talked about that, between these 2 organs that is communicating different messages to your brain. One way in which that is impacted is through food, but there are other things as well. There are other neurotransmitters involved, and many of them are involved through the gut as well, dopamine, GABA, and others. I think that the microbes that live and are part of the gut microbiome are really meant to be our friends. We want to think of them as people we want to take care of, because they interact with all of these substances, these neurotransmitters. Their environment is important, and something like serotonin. If you've ever known someone who's taken Prozac or Zoloft, which is fluoxetine or sertraline, these are SSRI medications, selective serotonin reuptake inhibitors. Initially, their side effects can often be, not everyone, but many people have gastrointestinal side effects, a little bit of nausea, discomfort, not sort of gastrointestinal, let's say. But the reason for this is that 90 to 95% of the serotonin, as well as the receptors, are in the gut. It's also made in the brain and elsewhere, but it's centered around there. And that is part of the reason that starts to explain it. So we want to think about what are the ways that we can really take care of these microbes, because they interact with the neurotransmitters, something that we've not really thought about or focused on before. And of course, they can be changed through medications and many other ways, but it's one of the ways.
And that was actually one of my questions is endogenous versus exogenous neurotransmitters. So I think obviously we would want our endogenous system to be fully functioning. But how do you feel about, and I think pharmaceuticals is a conversation that a lot of people want to hear your thoughts on, but even just supplementation.
Let me start with supplementation. I've matured in my opinion in nutritional science, and part of that is because none of us eats a perfect diet, and there may be nutritional gaps that we need to fill with supplements. If you live in the far northeast, like I do, many people may be vitamin D deficient, and I'm a test don't guess kind of person, so I suggest that people speak to their doctors about getting the right lab test to check that level if they're concerned, and supplement appropriately. I also think that supplements fill these gaps, even in our diet or environment. So I think there's a place for them. I don't think that you can out supplement a bad diet. I don't think that I think your community would be very savvy about that. But I think what we want to be able to do is eat this, 80% of the time, eat that more wholesome, whole foods, healthy diet that is brain food forward, fending off things like neuroinflammation, and 20% of the time, some flexibility, because all of our lives have to be that way, because we're normal humans and none of us is perfect. Supplements, totally okay. I think that in terms of the endogenous and exogenous, I think that there's a place for medication, and here's why. In my practice of more than 2 decades, and all of the patients that I've seen, some people really do need a medication, and it can be life-saving for them. I would never suggest nutritional psychiatry methods as the first line of care for someone who's actively suicidal, manic, psychotic, on the depths of despair. Food can always be part of the solution, but they may need more acute care. And that's where medications and other forms of treatment are important. So I embrace them when necessary. I still on occasion prescribe medications, but more often the individuals who are coming to see me are looking for that additional tool in their toolkit. And that can come through nutritional, metabolic, and lifestyle measures that we can work on together. And that's where I think optimizing what is within our body already through lifestyle and exercise and hydration, but also food, becomes really key to optimizing your brain health, because it's so important. I mean, without our brain, the rest of our body doesn't function. So I'm glad that you're highlighting that to your community.
And so just around some of the things, let's assume that you've got somebody who is living, in your opinion, an ideal lifestyle. They're minding sugar and alcohol and have a very healthy diet. They've eliminated a lot of the aggressive, offensive environmental things. They've got their inflammation in check, and they're just wanting to optimize brain function. I'll use myself as an example.
Okay.
So some of the things that I think about, and I'd actually love to hear from you, what are the things we should really be thinking about? I think about fish oil. I think about turmeric as a supplement, because I don't think I'd ever be able to eat enough turmeric. I think about certain herbs. I definitely want to hop into your some of the Ayurvedic brain care. But there's some herbs, there are certain supplements that I've been trying that are not sure if they're working yet. There are peptides that I've been interested in. Minerals that I go for, and hydration. Within that, could you give us some more specifics or things that really you feel like if somebody wants to take it to the next level, that's a ticket?
Well, I love that you're involved in all of that, Amanda. It's amazing. So what I also like is I really use a holistic and integrated approach. So while I focus in on nutrition, and that's the nexus of my work, hydration, critically important. Why? Because dehydration can lead to severe anxiety and even a panic attack. So keeping hydrated is very important, and dehydration has been linked in research to a low mood. So it's not as not as simple when we just think, oh, we need to drink enough water. There's actually science-backed information behind why for mental wellness. Exercise, some form of movement that appeals, yoga, Zumba class, whatever works for you, keep your body moving. Critical not only because we know that the endorphins give us an uplifting feeling, but also other things, just our cardiac health. It's all related, right? Because mental well-being and mental wellness is not an above the neck concept. So we're trying now to integrate all of it. The appropriate, with Ayurveda, I'm not an Ayurvedic practitioner. I have to say a lot of my Ayurvedic knowledge just comes from being in a family where there are some practitioners. But what I can say is I think ashwagandha is a great herb. When you get it in a supplemental form, if it's not in a pill form, because it's bitter, if it's added to something else, just look for the sugar content. Because it's a bitter herb, sometimes a lot of sugars are added to offset that taste. So definitely love that in solutions. Turmeric, if you're using it either to cook, you actually need about a quarter teaspoon a day to get yourself started with a pinch of black pepper. But a clean supplement is a great idea. Always use it with black pepper. So the piperine from black pepper activates the curcumin, which is the active ingredient in turmeric. It activates it and it makes it about 2000% more bioavailable to the brain and the body. So just a no-brainer there. So if you get a supplement, make sure there's black pepper. A lot of the supplement companies are savvy to that and they have the black pepper included for you. So exercise, diet. The other thing is, which I know you do, is just outdoor time. So shirin-yoku, or as a Japanese practice, to forest bathing. And I say to people, if you live in the city, try to embrace going to the park, just spending time outdoors. If you're fortunate and live near, much closer to nature, embrace that, because that has been shown to have a positive impact on the brain and the body. Also, 10 minutes of time spent in daylight without sunscreen and not through a window will actually provide 80% of your vitamin D for the day. And here's the thing with vitamin D, it helps mood and anxiety. After 10 minutes, I ask people to put on their sunscreen or sunblock, whichever you use, because you obviously want to practice sun safety as well. But that amount of daylight is actually good. It's good for it to enter your body, your skin. It helps your sleep and circadian rhythm. All of that is important. Other things are a meditation practice that appeals to you, or mindfulness practice. For me, on some days, it can be a sun salutation yoga, just to kind of center my day. For other people, it might be a breath work exercise. One of the things I do want to mention in this narrative is that, you know, the power of breath work or deep breath with anxiety, which is one of my areas that I work and have seen so much in COVID, is super helpful. And sometimes I ask people to be practicing a little breath work exercise that appeals to them, and you can find many on the internet that are validated, so that when they feel the anxiety coming up, they have a tool to go to. I think is super powerful as well. Um, and I think there are probably a few more, but I think that kind of for me rounds it up and means that you're sort of taking care of your brain health, your physical health, but you're taking it to another level.
Mhm. Thank you. Um, blue light in particular, but I know people are quite obsessed with blue light and blue light blocking and what it does to the circadian rhythm and, you know, all of that. But I've also been really sensitive to LED lights.
Hmm.
Um, I'm forgetting the name now, but the common kind of like office lighting that's actually,
Like fluorescent
yeah, it
lighting.
gets
Yeah,
strobe
yeah,
a
yeah,
bit.
yes, yeah. I know what you mean. Yeah, yeah,
I am often sitting in the dark. I'm really sensitive to light.
yeah, yeah, yeah.
Um, it will hurt my eyes. I find it's harder to work at a certain point. If I'm sitting in a room and there are many people talking and I'm trying to focus, I find that the lighting, if it's aggressive, will just
Mm,
push me over the edge. And if I can turn the lights off or turn half of them off and rely on some daylight, my brain just calms and can focus and center. What do you think that's about?
I think that light is. I don't know the underlying cause for the sensitivity, but I have heard this. I've heard people be so sensitive to certain kinds of light that can even offset a migraine, worsen a migraine, bring on a migraine, affect sleep. Things that I do know is that uh, for sleep and for circadian rhythm, not say doing your supermarketing or shopping at night where you're in bright lights, not keeping the television on and having all your devices on and near you definitely impact the connection with your brain, your ability to sleep, as well as your circadian rhythm. The sensitivity, I've I feel needs to be explored a little bit to find solutions. I mean, you shouldn't have to, unless it's just more comfortable for you, not have to be in the dark that much if it's kind of affecting it. Have you ever had that tested or checked? I'd just be curious to see if there was a connection.
Yeah, I've been to all types of doctors, many doctors.
Yeah.
It doesn't feel like it's debilitating. It feels like a lifestyle choice. I know in general
Oh,
I'm
okay. Yeah,
more sensitive.
that's
So,
cool. Yeah.
um, you know, like I'm really into my water filtration system. I have
Yeah. Yeah.
the air filters that I'm really
Mhm,
into.
mhm.
Um,
I love that.
I'm sensitive to stimulation, you know, so I'm like not the person
Mm.
that could just have a TV on in the house
Yes.
going
Yeah.
in the
Yeah.
background. And I find that
Good.
light one of those things, and I wonder,
Mhm.
um, are we going to find out much more about all these different
Mm,
types of light that we're living with and what's
mm.
happening with our brain in response to that? I don't know.
I think that's really cool, and I would love to look into the research around what's out there regarding light. I know that I'm sharing the kind of limited body of knowledge I have around it, but I feel like there's so much there because I think the when I hear about it, the most is around sleep
Mm,
and people just not being able to settle down in the evening. And insomnia got so bad during COVID that it's called coronasomnia,
mm,
and people are just struggling to sleep. But light is one of those things, and that's where I gifted someone recently a pair of blue light blockers because she suffers with such intense migraines, and I wondered if it could just help her with that. And I'm curious to hear her thoughts on it. So I feel like all of these, we're trying to come up with solutions for these issues that modernization of the world has created. Same thing with food. So it's definitely true.
Okay, I'm going to hop into all of our community questions that I have
Okay.
separated into 5 categories. And we're going to start with depression. We
Okay.
got so many people, and so I'll preface this with the people that are writing in with their questions for you around depression. They have a doctor, they're working with a doctor. In many of the cases that, you know, we have questions around coming off of SSRIs.
Mm,
Everybody's prefaced that, yes, they are working with a doctor, but they'd like some of
yeah.
your expertise in there. So maybe if you could just tell us some of the long-term effects that you know of that may come with SSRIs.
Happy to, and thanks for clarifying that, Amanda. I mean, I know we're having a conversation for your community. I know that they understand I'm not their personal doctor, but I'm happy to advise. You know, I want to say that the research has shown that very large percentage of individuals don't recover or that's I misspoke there. That they don't fully recover from an episode of depression with medication. So medications we have realized are not necessarily the end goal. They're one of the solutions. So if you're on a medication and it's working, I definitely want to encourage you to work with your provider to stay on it and find a way that you can continue to help it uplift you. But along with that, nothing prevents you from trying out all the lifestyle measures that we've been talking about, because I truly believe, and I can say this has worked in clinical practice, can uplift that, and at times have been able to cut back on a dose of medication and on occasion slowly taper someone down over time. It's a slow process. It has to be closely monitored, and we have to make sure that when we do that taper of a medication, even if it's to a lower dose, so say 20 milligrams of Prozac to 10 or 30 to 20, all of that has to also be done with someone observing your symptoms improving and you feeling less depressed. So it's a very careful calibration, so to speak. Let's start with some long-term effects. People have struggled with issues around libido, weight gain, a feeling of dullness. It's almost a feeling a lack of luster, like not feeling a little bit emotionally blunted. And those are kind of the negatives I've taken away from my practice. All to say that if the person is no longer suicidal and at least their mood is more even, we have to balance what's the best for your life moving forward. Do we adjust slightly? Do we monitor? Do we increase all your lifestyle measures to support what's going on? Tapering is a very careful calibration, and let me tell you why. In my clinic, in my earlier days of being in a community clinic, you can do a taper faster if someone is otherwise healthy, able to tolerate it. And people are different. Something like Effexor, called venlafaxine, is a very slow taper because it has several side effects, and it actually has a little bit of withdrawal that goes along with it. And I've seen it clinically. As I say that, I've also had people be able to taper and be okay without side effects. So our gut microbiome is like a thumbprint. Everything is different. Slow taper, if you are tapering it, work with a clinician closely, increase your lifestyle measures. They can all help. And long-term side effects, if you're experiencing some of these, maybe have a conversation with your doctor and say, I have, this problem with my libido, or I'm noticing that my weight is just different. Are there adjustments we can make as I, include some lifestyle measures? Can you work with me around that? I think we have to advocate for ourselves in this realm because, to be honest, Amanda, psychiatrists are not practicing this way. And part of my mission is to include these in the conversation, not to exclude one thing or the other. For example, forms of therapy, incredibly important. I'm a huge supporter of therapy as well. So I'm not saying take away the solutions you have in place, just almost augment and make them better than they are. And one way to do that, as I'm working hard to train more clinicians in this area, is to ask the questions.
And so for the people that have written in and they have come off, they've tapered off medication with their doctor. Um, they've gone through some withdrawals, they're over it. Um, what I mean, you've mentioned all the lifestyles, so that we can go back, they can go back and make a list. All of those were very simple. It was like sleep, hydration, um, some diet and lifestyle things. Is there anything else that you feel like you've really seen move the needle with somebody who is able to treat depression without a pharmaceutical?
I think a combination that works for them. I've had people who don't like to meditate, and they find it something that they can't buy into. It's just not for them, but they can do a breath work exercise. I think that each person in my practice has had a unique combination that's worked for them. So
Mm.
it's a little bit more personalized based on, say, the form of exercise they like. Is it one thing? I'm sorry, I can't nail it down to one thing. And part of that is because I feel like um, it's always it's almost like a little mini prescription for someone and what really works for them.
Yeah.
Um, a person who is coming off a medication, and I had this happen clinically, was still, a little bit depressed, and not terribly depressed, less so in managing. One of the things that she did was she just engaged in a walking program, and she didn't have the energy to do a cardio workout or even go to the gym yet. But what she did is she formed a walking group with two women in her neighborhood, and she just began to walk every day. And she found that the benefits of a simple thing like that was key to, she felt better, her cardiac status improved, she was getting in so many steps a day, she found a sense of community around these friends that she made, and over time she told me that she even lost weight. So I think it is unique for each person. I don't think it's one thing.
Yeah, fair. Um, we also got a lot of questions. So I have another little, we can dive into brain fog, but
Yeah.
there were people writing in about COVID. So a lot of questions
Yeah.
about COVID. I personally experienced long COVID for almost a year.
Wow. Wow.
Um, and so we're getting some depression questions, depression,
Mm-hmm.
anxiety, post-COVID. I could throw myself in that category and say that, yeah, there was like a very low grade, low energy, issues with recall. Some people are calling it brain fog. I would be more specific and say for me, it was like real issues with recall, and then
Mm.
some kind of very low grade, low energy depression like
Yeah.
feel.
Yeah.
What do you think that is?
I feel like it has, well, let me take a step back and share some research for a second, which I think could be helpful.
Mm.
Mass General did a really fascinating neuroimaging study. And I share this in the context of understanding that you're talking about the people who've had the infection and are still struggling or had struggled. But this research study looked at individuals who didn't have COVID, who didn't have the infection, and looked at their brain, those elements of inflammation or lack of inflammation. And they found that even in individuals who did not suffer the actual infection, they showed neuroinflammation on these neuroimaging studies. And what it taught us, what we interpreted from that, was that there was this effect of those several years that even people who didn't have the infection showed brain changes. What that led me to assimilate in terms of information is if you did succumb to the infection, it has to be even a greater effect on your brain. The things that we know from research are that the levels of depression and anxiety almost doubled post-COVID, and new cases. Not everyone had depression. These are sometimes new cases. I have to associate that and feel the research around long COVID or long hauler syndrome has been pretty robust.
Mhm.
As to why, I think that it's a combination of the actual brain effects, the neuroinflammation, everything else that was going on, during COVID that has affected our bodies. It's almost the word, and I take this from an article I read in the New York Times. People have this sort of languishing feeling. It's just you're not focusing that well. You're having low energy, fatigue. You're foggy. You feel you can't focus on things that you couldn't focus on. Your mood is just not great, and it's like you're not getting back to being yourself. And I've heard this a lot. I think that in addition to the measures we've talked about, there's certain things that can help brain fog. Luteolin is an antioxidant that has been shown to help brain fog, and it's in things like juniper berries, fresh peppermint, sage, thyme, hot and sweet peppers, celery, parsley, artichokes. Some of those, and there's a longer list in my book, but these luteolin foods can be added to things that you're eating. There are also a substance called phosphatidylserine, and these foods, again, I'm going to the food sources because those are easier for people, are things like white beans, pastured eggs, grass-fed dairy if you consume that. And then there's citicoline-rich foods, which include things like grass-fed beef, but beef liver specifically, and things like egg yolks. So a few things that we know can hone in on those symptoms. Maybe remember it's a marathon, not a sprint. So including these in your diet and evolving change over time will hopefully help with that level of what people are really suffering with, almost fatigue and brain fog is what I see a lot of. I feel we'll be able to find more solutions over time. Another thing that I suggest to people is green tea. Green tea is rich in two antioxidants that are L-theanine and EGCG. And what I like about green tea, it can give you a bit of an uplift, like in the afternoon, without the buzz of a cup of coffee or an espresso or something like that. That's if you consume coffee. So I think green tea is another great solution to kind of create that level of maybe a bit more alertness than that you want to feel.
Mm-hmm. And this is reminding me of a question we got around veganism and depression.
So I feel I'm respectful of the different dietary habits or diets that people follow, but I feel, and just for transparency, I was born into a vegetarian family, so I've always been plant-based because that was what my family ate. But the family I married into, and my husband and others eat anything, so I'm cool with whatever people eat. But I think that what the research has shown has been a little bit mixed. There's research showing that when you lean into the plants and you eat a lot of plant foods, we know that the fiber, the phytonutrients are really healthy for us. There are also individuals who feel, well, you need meat for your vitamin B12. If not, you're not going to be good. And there's studies that therefore show, unless you're eating animal proteins in your diet, including the omegas from seafood or plant-based sources, that you're not going to be okay. So I think there's a little bit of a split opinion. What do I think? If you are eating a plant-based, whole food, plant-based diet, vegan diet, even though people will say, well, you're getting enough of your nutrition from your food, I think the things you should be aware of are an algal oil supplement, because plant-based sources of omega-3 are the short-chain omega-3s, and they are just less able to convert, and you're going to get less is the bottom line about it. So consider an algal oil, which is a plant-based supplement for your omegas. If you may be lacking B12, if you're not consuming meat, and therefore you may want to consider, supplementation with that. Everyone's body is different. You may not need it, and you may be eating things like nutritional yeast, which are fortified with vitamin B12, so you may be okay. I think in terms of mood, check in with how you're feeling. If you are recently changed your diet, or maybe you've been a long time vegan, check in emotionally with how your mood has been. Ask your friends, your family to comment on that, because if you're noticing a change, because I might have had patients become vegan and notice that they've had a dip in their mood, and then start including back some animal protein and start to feel better. I've also had the opposite happen. So I want to be clear that every person is different. But if you are consuming that diet, be aware of some foods you may need to supplement, or vitamins that you may need to supplement, so that you can have robust brain health, and still feel good.
Yeah. So we have a lot of questions around, and I know they're not the same, but I'm going to put them all in one category for the sake of time in our conversation. But dementia, Alzheimer's, Parkinson's. And so I'd say the two categories of questions that we got were around measures we can take now to make sure we don't wind up in that situation. And I'm making assumptions, but it seemed as if there were people who have parents or loved ones that do have Parkinson's, Alzheimer's, dementia, and they're wondering if there's anything to do to reverse that.
The things that I can share on memory and cognition are that food can be powerful. We don't know that food can yet reverse these conditions, but what we do know is, we mentioned neuroinflammation earlier on, and I want to place this in the context of the fact that I don't know if anyone has heard this kind of description of cancer before, but many of us may be walking around with precancerous or even cancerous cells which haven't yet evolved or grown or been triggered by other mechanisms to grow into a cancer. And I'm not trying to scare people, but this is just how our bodies work. That's why things like how we eat and what we do becomes important. Similarly, in our brain, many of us may have subtle changes that may just stay the same if we are paying attention to all the stuff we've talked about, remembering their genetic and environmental influences as well. And those changes may just remain and nothing may happen, but they also may get worse. And one of the things that worsens them is neuroinflammation. So if we say continuing to go to fast food restaurants, or continuing to lean into inflammation producing actions through food and other ways, that those changes can then develop on a spectrum of cognitive problems. And that's where we can intervene, especially with food. We can eat to lower neuroinflammation. One of my colleagues is a long-time leader in Alzheimer's research, Dr. Rudy Tanzi at Mass General, and he talks about neuroinflammation all the time. He has an acronym called SHIELD, which you can Google. And one of the things he talks about is how powerful food can be to lower that inflammation. So it's something any one of us can do, because we may be walking around with changes we're not even aware of. If you have loved ones in your family who are struggling, just improving their diet by using something like the MIND diet, which is really very, very plant forward, but also includes things like healthy olive oil, some whole grains, fish, beans, poultry, and things like that. And the MIND diet has a lot of research behind it. The researcher was the late Martha Claire Morris, and has some good data behind it. So MIND, there's certain hospital sites, and their site itself will actually offer you suggestions as to the food plan and help you design it for yourself. But other things are a small amount of coffee was thought to be helpful if you do consume coffee, olive oil, we mentioned, herbs and spices, turmeric with the black pepper, cinnamon, saffron, rosemary, ginger, and sage are some of the spices to start to kind of incorporate in your foods, for yourself or for a loved one, into a tea, into a smoothie, however you want to be able to consume it. But those are some guidelines to fend off inflammation in the brain, changing lifestyle practices, and then upping your game on nutrients and nutrition.
Okay. We are coming up on the hour, and so I'm not sure about your timing, but there is one question I definitely can't let you leave without answering.
Okay, happy to do it.
And if you have time, we have if I could ask you two questions. One, and this is maybe a quick one, but we got a question from someone, and I think this is an important question. As weed, marijuana is becoming an industry unto itself, and we see that it's also merging a bit with the wellness industry, beauty industry, tech. It's what is your thought on marijuana and brain function?
Yeah. So the different forms of, I know your community will know this, there are different forms of marijuana, and they're the forms that affect the brain and that don't. I think that the research is early, and I think there's a lot of excitement about marijuana, psychedelics, microdosing, all sorts of things. I think it's an individual choice. I think a discussion with your clinician or the right clinician around something you want to try. Our brain is a delicate organ, and we don't want to mess with it. So I just want to say, without our brain, the rest of our body doesn't function. So completely fine to explore these in the right setting with the right clinical provider involved. There are more and more doctors who now are able to comment on this. Personally, Amanda, in my scope of practice, I've also seen the downsides of this. Marijuana is legalized in a lot of states, and working in Massachusetts, I've seen the negative impacts in the emergency room. I did a major teaching hospital where even if something is legalized, people obtain it recreationally and maybe mixed with substances, which have caused things like psychosis, paranoia, memory impacts, changes in their diet, and not lots of sort of negative impacts. So I want people to embrace what's new, but do it with caution. Get the right advice before you try it, if that's a path you're going down. I think the one of the things that's come up is like the types of gummies and things out there, and you just want to look for the cleanest products, what is regulated and what's not, because that becomes important too. There was some information I came across recently. There was a much higher level of CBD in something, in gummies that were being sold. So I think those are things you just want to be cautious about, and cautious but open.
Okay. And so this is my real last question. You have to answer
That's right.
before you can go. What do you feel like is either a huge breakthrough that's happening in psychiatry now, or what do you think is going to be in the future?
Love that question. I think for myself, the biggest breakthroughs are actually happening around the gut microbiome research, both from the academic side and industry or business side. There are companies, so academically, people are looking at, the impacts of prebiotics, probiotics, symbiotics, psychobiotics, substances potentially that can be in the form of food that can affect mood and other mental health conditions. Very excited about that. On the industry side of things, there's some excellent companies just taking their microbiome testing to another level, where they're talking about not just your DNA involvement in the microbiome, but the RNA involvement. You get their test kits, and you can kind of do the program at home. But what they try to do is based on the uniqueness of what your microbiome is showing them, design personalized supplements for your microbiome, and then track to see how you feel. I think these solutions are very exciting. I'm excited to be involved in some of the research, and I think that it's a direction I want to see grow, always backed by really solid science and studies in more humans, so that we know we have more solutions. Even if some of it is in a supplement form, I'm okay with that if it's going to help people feel emotionally stronger.
Mm-hmm. Thank you. Yeah, I was just speaking with a doctor the other night. It's interesting. I've actually been trying their product, but they have a fecal transplant clinic. So that is
Okay.
they're working with people that
Mm-hmm.
legally, to have one, you have to
Mm-hmm.
be very specific candidate. they're doing this other thing that's cleared by the FDA, but it is completely sanitized stool material. And so,
Interesting.
yeah, they're taking the metabolites essentially
Well,
out of multiple donors that get screened. So
fantastic.
yeah, yeah,
That's really cool.
yeah.
I'd love to hear more about them.
I'll
But
follow up with you on that.
yeah.
Thank you so much for your time and for your expertise. And I'm always watching you. So
Oh, thank you.
I can't
Thank
wait to
you.
see what you share next.
Well, thank you, man. It's been lovely to talk with you. Such great questions from your community. I only hope those the answers help to answer some of what people are seeking, looking for.
Yeah. Thank you so much.
Thank you.